Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. Before we meet our guest today, I want to do a COVID update for you. Globally, we have 165 million cases with 3.42 million reported deaths. In the United States, we've hit 33 million cases with 588,000 deaths. Our sympathies go out to families and friends of those who have lost a loved one during this time. In the city of Nashua, to date, we have 8,018 cases. Actively this week, we have 93 cases. Our new infections per 100,000 are 193.6. This is trending down each week. This is the first time we've been below 200 cases per 100,000 since October. Wahoo. Our 7-day total test positivity rate is 4.1%, also a green metric for this week. In Greater Nashua, our total cases to date are 17,663, and our active cases are 160. Looking at our next graph, the percent positivity, as you can see, is steeply declining when we get to the far right of the graph during May. That nice downward slope is what we continue to hope to maintain as people increase getting the vaccine and still wearing your mask when indoor spaces and taking precautions. And our next graph shows the cases in Nashua specifically, in contrast to the state graph you just viewed. And this, again, you see a nice downward slope at the far right hand of the graph, and we'd like to keep that going through our mitigation strategies. Just finally, when to get a COVID test. If you develop symptoms of COVID-19, loss of taste or smell, cough, shortness of breath, fever, congestion, runny nose, nausea, vomiting, fatigue, or muscle aches, please take the necessary precautions and get a COVID test. Or if you've been exposed to a positive case of COVID-19. Remember, it is allergy season. Don't confuse the two. So if you're having allergies worse than usual, it's time to call your doctor and arrange for a COVID test, because it could very well be COVID-19. We do offer free COVID testing every Tuesday in the Elm Street parking garage from 3 to 4:30 p.m. You can go online to schedule an appointment, or you can call our COVID hotline at 589-3456. And finally, I just want to remind everyone that we still are in a pandemic, even with rates going down. We still have to take personal responsibility and stay home if we are sick, except to get medical attention, to wear your mask in stores, offices, and other public places, restaurants, houses of worship, other small businesses. It is still recommended to wear your mask, and there still is a mask ordinance in place in the city of Nashua. Avoid poorly ventilated indoor areas. Keep a distance of 6 feet from those not in your family. Wash your hands often, 20 seconds in warm water at least. Sing happy birthday. Do what you have to do. Keep those hands clean. Be part of the solution. Keep your mask on. It's very tempting to take them off, but we want to remind people that the mask ordinance is still in place in the city of Nashua, and it will be until a change is made by the Board of Aldermen. Our vaccine dashboard this week shows a nice steady increase, all the way sloping up. Our 2 lines are meeting, so that means more people are getting their second doses. We have a lot of people fully vaccinated, 44.2% in the whole state, which is great progress. So we want to remind people, if you've had your first vaccine, to come back and get your second one at the time. There are a lot of options for vaccine right now. A lot of the drugstores. Go to nhvaccines.gov. You can register. And I'm very happy today to introduce our first guest, which is Dr. Sharon Vupala. Dr. Vupala, welcome, and thank you for agreeing to be on Public Health Matters.
Thank you for having me.
So Dr. Vupala, you have a very interesting and timely specialty. You're a pediatric infectious disease specialist and work currently as a hospitalist at St. Joseph's Hospital. So I just want to back up and talk first and foremost, and you've prepared some great graphics for us today, which we'll get to. But first and foremost, what your experience has been during COVID as a hospitalist and seeing pediatric patients as well, and what the pediatric experience has been with COVID.
Yes, so at St. Joseph, we've seen a marked decline in pediatric infections overall due to the fact that children are now doing more in-home schooling and not doing their normal activities. And though that sounds good, that is reflective of the drastic lifestyle impact that COVID-19 has in the pediatric population. I've also have now clinical experience for the past 1 year of taking care of newborns who are born to mothers who are COVID-19 positive. And that has been really trying at times, because one of the first discussions we need to have, this soon mom-to-be that's going to have this amazing experience with her newborn, is we have to have the discussion of, what do you want to do with this newborn? Do you want to have the newborn in the room with you, or do you want to separate the newborn from you? We also have to do a series of testing in the newborn to make sure the newborn does not have COVID-19. So it's been a tough season of the pandemic.
So in the beginning of the pandemic, did you see a lot of pediatric patients with COVID? Did you have any in the hospital? What was that like?
So our clinical experience in St. Joseph is reflective of the overall national incidence of COVID. At the start of the pandemic, pediatric cases consisted about 5% of the overall COVID positive cases. So that was pretty consistent with what we saw in our emergency room and in our clinics. So not a whole lot of pediatric cases. And
And how did
now
they do?
that is changing.
Yeah.
Okay. So, like I said, at the start of the pandemic, it was 5%, and then in the middle of the pandemic, it went up to 10 to 15%. And now the overall pediatric COVID-19 case incidence is about 24% right now nationally. So it's creeping up, which is why I think our discussion today is so important.
Right, and very timely, because just 10 days ago, I think it's about 10 days, if I'm not mistaken, emergency authorization was given for the Pfizer vaccine for 12 to 15-year-olds, which is a huge leap forward, a nice big chunk of our population in New Hampshire and in the city of Nashua and greater Nashua. In fact, we've already had one vaccine clinic at the high school where they did over 550 children from age 12 and up. So that was real progress and very exciting. So we brought you here really to talk about the COVID vaccine and its safety for children and your recommendations. Why don't you just give me a brief introduction about when it was approved and what your experience has been with the Pfizer vaccine so far?
Yes, so as you mentioned, on May 10th, the FDA approved the Pfizer-BioNTech vaccine under the emergency use authorization for children ages 12 to 15 years of age. So the company Pfizer basically underwent a rigorous and clinical trial, which was a double-blinded, randomized clinical trial, which just means that there were children, around 2,260 children in the age group of 12 to 15 years of age that were randomly placed into two groups. One group that got the Pfizer-BioNTech COVID-19 vaccine, and the other group which received a saline injection or basically did not get the vaccine. So both of these groups were looked at and studied to see how effective the vaccine was and what the safety profile was. So as far as the effectiveness of this vaccine, it's very similar to the 16 to 25 age group, and also similar to the adult population, where the efficacy was around 95%. Now, the side effect profile was also very similar to the 15 to 25 year age group and that of adults. So there were no surprises here with this vaccine. In addition to that, the FDA looked at around 200 children in this age group and looked and actually saw what happened when these kids who were vaccinated, when they were exposed to COVID, what happened. And they found that 100% of the time, those children that were exposed to COVID did not get the infection, whereas in the group that did not get the COVID-19 vaccine, there was about 16 cases. So this vaccine is really groundbreaking because it is reported to have 100% efficacy in terms of preventing COVID-19 infection. So very groundbreaking and very promising initial results. So in addition to that, going back to the issue of safety, which is a concern for every parent when their child gets the vaccine, the FDA actually studied the vaccine 2 months after the last dose was given. And again, there was no concerns regarding safety or side effects. So all very promising results from the clinical trial.
And the vaccine is given the same way it's given to adults.
Yes.
3 weeks apart, 2 doses, 0.3 milliliters, which is a teeny tiny amount. It's amazing what that small amount can do. I watch the nurses draw it up and I think, wow, it's not very much.
It's actually the exact same vaccine as the adults have received. So same dose, same intramuscular administration, which basically means into the muscle, and given two doses 3 weeks apart is the recommended time interval for it. And yes.
So if I'm a parent, and this is a concern really not only for parents, but really people in general. A lot of people say, you know, we had Operation Warp Speed, that this was developed so quickly. So if I'm a parent, should I be concerned that this was developed quickly or not?
So yes, again, a very good question, certainly one that needs to be addressed. Being a parent of 2, I can appreciate that concern that parents have for the speed of this vaccine. But I want to clearly speak to a couple of points that were very unique to the development of the COVID-19 vaccine. So first off, right off the bat, I want to reassure everyone and let everyone know part of the speed of which the vaccine was developed has to do with our technological and scientific advances, which allowed us to very quickly describe the genetic makeup of the SARS-CoV-2 vaccine, which was originally isolated in Wuhan, China. So that ability to quickly delineate the genome of the virus was basically years of scientific and technological advances. In addition to that, we were in a very unique situation because we were studying a vaccine in the middle of a raging pandemic. So usually for a vaccine or drug clinical trials, it takes time to enroll study subjects. But here, because we had a high number of COVID-19 cases, we were able to study the disease as well as vaccination very quickly. And again, the term emergency use authorization can be a concern for parents.
It's a little off-putting.
Yes, and rightly so. But I want to ensure everyone that it was rigorously studied. There was no shortcuts that were taken. And the emergency authorization is just, it's basically the FDA's ability to quickly approve drugs or vaccines in an emergent situation, whether it's a pandemic, bioterrorism, or any other emergent medical need. So in addition to that, there's also a system in place which is called VAERS, which is Vaccine Adverse Events Reporting System. So that is a system in place to pick up on any significant events that happen that are related to the vaccine. And we saw that with the Johnson & Johnson. So that should reassure people that that system that is in place is working.
Right, there is surveillance,
Yes.
continual surveillance every day. We enter it when we do vaccine clinics. Yeah. So what's in the vaccine?
Yeah, great question. So again, as a parent of 2, you know, we look at the back of even a snack to see what the ingredients are.
Hopefully people.
Yes, and what the nutritional facts are. So how much more should we when it comes to a new vaccine that was just approved? So again, certainly appreciate that concern that parents have. So there are a few things in this vaccine. So one is the mRNA, which is a synthetic genetic material. So this is the active ingredient and the main component of the vaccine which elicits the immune response. So this mRNA is basically something that enters our body the same, and it codes for a spike protein of the COVID-19 and of the virus, and then our body then mounts an immune response to that. So that's one component of the vaccine. The other component is the lipids. So there's several different lipids. Lipids is a term for fats, basically. So these fats are derived from plant and animal sources, and they basically provide like an envelope to the mRNA and make it greasy, you could say.
Slippery.
Slippery, to allow for entry into our body cells. In addition to that, there are certain salts that are in the vaccine which maintain the acidity of the body while our body responds to the vaccine. And lastly, there's something called sucrose, which is basically sugar, and that is to maintain the integrity of the shape of the mRNA while it's being frozen and stored. So those are the components of the vaccine.
So very little is in it.
There are no preservatives. If there's any concern about that, there's no preservatives and nothing other than these vaccines, which we have very good experience with these components in other vaccines.
And when you say no preservatives, see, that's interesting to me only because we do a lot of vaccine clinics and we have, as people know, that this vaccine is stored at an extremely cold temperature. And that was initially a very complicating factor. You know, when to store it, when to thaw it, those kind of things. And now we've just learned that Pfizer can be stored even longer than we thought. It will be a little bit more shelf stable for longer, which will be a huge impact really on not wasting vaccine. If you're not ready to use it all. So, I mean, the big crux of this, so I guess we could talk right now, and you alluded to this a little bit in the beginning, but life without the COVID vaccine right now is not so rosy. Kids are stuck at home. They're not socializing as much.
Yeah, so again, a very important issue to discuss because we need to, as parents, whenever we make any medical intervention into the children, we need to know how is it going to affect our kids, right? So right now, as many parents know, there is remote learning, which has been very challenging for some kids and some families. There has been a limitation in the way we do sports because we need to wear masks. The kids need to wear masks when they do that, and that can be difficult for some kids. There's also the issue of adolescents being more on their devices and not being able to interact because of the various social limitations we've encountered in this pandemic, and all of those were very timely and appropriate mitigation measures that we had to go through. But now that we have a vaccine, the end game is in sight, basically, and that's what I want to encourage parents and teenagers about, that this vaccine is going to significantly change the way we do things and change your child's lifestyle, basically. In addition to that, I kind of wanted to go over why is this vaccine even important? Because
absolutely.
we talk a lot about how pediatric COVID cases are low, and as I mentioned, it's basically gone from 5% to now 24% of the total COVID-19 cases. We also talk about how hospitalizations from pediatric COVID cases are low. So why do we need to get this vaccine? So that's an important question. And I just want to point out a couple of things. So first of all, yes, pediatric COVID-19 case is lower than that seen in the adult. However, as I mentioned, the number is creeping up, 5 to 24%. Right now, there's a quarter of our COVID cases in the United States are in teenagers. So that's something that, we expected as the older population gets vaccinated and as there's more reopening and the restrictions are being relaxed. So we do expect that.
And kids are starting to go back to school, whether it's all week long or a few days a week. They are having more contact with one another.
Yes, so it is important to protect this age group now at this point, as we're seeing a shift in who's being affected by COVID-19. In addition to that, there are teenagers and children that are vulnerable to having long hospitalizations and long-term complications from this vaccine. And those are children that are obese, asthmatics, diabetics, anyone who has any underlying medical condition, immunocompromised, whether it's from a medical condition or a medication that they're on. So this is a layer of protection, a significant layer of protection for this age group. In addition to that, children less than 12 years of age have no vaccine currently that's approved. So when you have a sibling, a teenager who is vaccinated, and then you have a 5-year-old who can't get vaccinated, that 5-year-old is protected when you have the parents vaccinated and older siblings.
Right.
So again,
that was always my argument. I'm like, do it for the younger kids. If we can get all our high schoolers, they all have not all of them, but many of them have are the oldest in their family or have younger siblings,
Yep.
and it really starts to protect the whole family.
Yes.
So they're not bringing it back to the house.
Yeah. And we know that hospitalization from pediatric COVID cases is not as high as in adults, but it can result in, a week to 2 weeks of school loss. It can result in hospitalization for several days. And one other important thing to point out to parents is that there is this condition which is called multisystemic inflammatory syndrome that affects children with COVID. Again, it is very rare, but when it does happen, it can be a very severe and dangerous thing, and also affect organs like the heart, the kidneys, and other organs. So again, these are the reasons why it's so important for children to get vaccinated in this age group.
Yeah, so this is just really fantastic information. And one thing, you had sent along some slides, and so all of these graphics are coming from you, so I really appreciate that. We talk about maybe taking our masks off and what the
Yes.
advantages are, especially for children.
Yes.
And you talked about like social interaction, and
Yes.
let's just maybe the importance of that.
Right. So we spoke about how our children's lives are right now with COVID-19 in the middle of this pandemic. So let's talk about how things will change after vaccination. And this is the most exciting thing and the thing I like to talk about most. So number one, we can start thinking about unmasking, though right now we are not there. And I want to stress that and reiterate that. We could potentially have unmasking of children in the fall or maybe even early next year. So that's something to consider that we're moving forward in towards that goal. The other thing is children don't have to maintain the 6 feet distance anymore, which anyways is very difficult for kids to do.
Yeah,
but
especially in school.
Yeah.
I don't know how they do that. I mean, if
Right.
you're passing in the halls or you're at your desks or,
Right.
you know.
So we can think about, having them interact more in a normal way. We can also go back to playing sports, possibly in a more normal way. And it is so important developmentally. They're at a stage where they need to be laying down those social skills and foundational aspects of their development. And it's very tough to do in the midst of a pandemic.
Yeah,
So
and
the goal here is to get parents and children vaccinated so they can go back to normalcy. Of course, it's not going to be, or the new normal, I should say.
Right. I think
so-
we'll be changed for quite a long
Right.
time. When you say back to sports, it just makes me think about my own son playing basketball in his mask, dutifully, faithfully.
Right.
But it's not so easy
Yeah.
to exercise in a mask.
Right.
You do have trouble pulling in that air. And to those kids out there that are toughing it out, I really applaud you. For taking on that challenge, because it's not easy. Luckily, a lot of our high school sports and middle school sports are outdoors, so we've been able to make accommodations, but most of those kids are wearing masks while playing their sport,
Yeah.
even if it's outside. So it will be really nice that maybe at some future date to have some of that normalcy back. And then you mentioned this potentially in schools as well.
Yes. So right now in New Hampshire, there is still a substantial amount of community transmission. So we are not able to unmask at schools. And in general, there are going to be certain situations where masking may be continued, like hospitals, schools, large congregate settings. So that, we may still have to mask at school, but there will be an additional layer of safety. And the reason we will continue to mask despite children being vaccinated is not to torture them, but it's really studies have found that when we do vaccination and continue mitigation measures, that really drives down the numbers, which will then again push us toward that goal of unmasking.
Right. So we really
So-
have to stay the course.
Yeah.
And I know personally, whatever standards are left right now, that I will keep my mask on when I'm going indoors, and I am fully vaccinated.
Yes.
But I will still, because you don't know when you go into a store or you go into a place of
Right.
business, who's vaccinated and who's not. And we're not going to get into the whole vaccine passports right now and
Yeah,
all of that
yeah.
and flash your ID. So my thing is, well, just keep wearing it. What's the big deal?
And there's a 10% chance of being infected even after you're vaccinated. Again, very rare, but that possibility is
Right.
there. So especially if you're a vulnerable individual, you should continue the mask on.
Yeah. So just quickly, like, are there side effects to the vaccine that parents should be aware of? Maybe the parents have already had their vaccine, and the side effects, of course, are different in everybody.
That's true. That's true. So if you're a parent who's already gotten the vaccine, you can basically expect the same thing in your teenagers when they get it. So the side effects can be categorized into local side effects, where basically localized tenderness, swelling, achy arm, maybe some redness, and then as far as systemic, or what we say systemic, you could have fever, chills, maybe a headache, muscle aches, things like that. And so those are the very, what we say, benign or not concerning side effects. And that can go on from a day to around 3 days. Okay. But in terms of more serious side effects, there's basically two. Okay. One is anaphylaxis, which is a term for severe allergic reaction to the vaccine or one of the vaccine components. And teenagers, especially have this propensity to fainting after getting vaccination. So, your doctor will have administered the vaccine lying down, and will have your teen lie down for 15 to 30 minutes after the vaccine.
If that's something that they tend to do, or is that,
Yeah.
So you had sent this great slide, and we'll put that up, and I would just love for you to debunk some of these myths about the vaccine kind of in closing, because this is not just for pediatrics, this is for everybody. Because we really want people who have kind of waiting and seeing how is it going to go. Now's your chance to get out there and get the vaccine.
Yes.
So the first one is that, let's see, COVID-19, the COVID-19 vaccine alters your DNA.
Yes.
One of my favorites.
Yes. And this is our first mRNA vaccine. We have DNA in things like hepatitis B vaccine, for example, but again, a legitimate concern. So basically the answer is no. The mRNA does not enter a part of the cell called the nucleus where our DNA is. So it is not possible for this vaccine to alter a person's DNA.
Okay. And then we did address that it isn't safe because of the quick rollout, but I think you addressed that really well already. Food allergy, immunocompromised, breastfeeding, or pregnant people can't get the vaccine.
Yes. So immunocompromised children should absolutely get the vaccine. The types of vaccine those children are not able to get are live vaccines, such as with the MMR or the chickenpox vaccine. This is not a live vaccine, so immunocompromised individuals should absolutely get it. Pregnant women should talk to their healthcare providers and discuss the pros and cons of that.
And this is reminding me, too, that now if you're getting a childhood vaccine, an immunization, you can also get the COVID shot at the same time.
Yes.
So that there's no reason to come back and, unlike with the adults that are waiting between like a shingle shot and
Yes. This is very important. Initially, the CDC or the FDA recommended a 14-day period between the COVID-19 vaccine and other vaccinations, and that was because of an abundance of caution, you could say. But now, to increase the uptake of the vaccine and make it convenient for patients, you can get other vaccinations the same day you get your COVID-19 vaccine for your kids. And interestingly, one of the secondary negative effects of the pandemic in pediatrics is that vaccination has gone down, and particularly the gap is highest in teenagers. So there has been around 19%, not 90, 19% decrease in adolescent vaccines such as Tdap and HPV, and 15% decrease in the meningococcal vaccine, which is the vaccine that prevents meningitis.
Very important, especially for kids that are going off to camps or colleges or other things.
So again, I know sometimes there's parental worry about multiple vaccines being given at the same time, but it is safe, and I encourage parents to get it done in one visit.
Yeah, and just a reminder that in our immunization, our mobile van goes out, and we do offer those childhood immunizations, those required ones, and we do have the COVID vaccine too, if your child is eligible at the time. And let's just a couple more, and then we're going to have to wrap up, but this is so interesting, so I really appreciate it. I'll get COVID from the vaccine.
Yeah. So again, it's not possible to get COVID-19 from the vaccine, and sometimes the side effects from the vaccine itself can be confused COVID-19 infection symptoms, and it's separate things.
It's a separate thing. And I've had COVID before, so I don't need the vaccine.
Yeah, so currently we don't know how long you're protected after what we say a natural infection or after getting COVID-19. The CDC says that there might be some protection for up to 90 days, but after that, there is a possibility of reinfection, and I've seen it in my clinical practice, so I really recommend for kids who have gotten the infection to get vaccinated and extend their period of protection.
Yeah. Well, this has been great. And then overall, just the benefits of community vaccination, that it does prevent severe illness or death from COVID-19, protects yourself and others.
Yeah.
The vaccines work in your body's immune system. After 2 weeks of your second vaccine, you don't have to quarantine if you've been exposed to COVID-19.
That is true. Very good.
And you can be around others that are fully vaccinated without your mask.
Yes.
And again, you have to be trusting.
Yes.
So I would say family members or close friends that you know, maybe small gatherings. So Dr. Bubla, thank you so much. This is really informative. I learned a lot about pediatrics, and I will say that my 16-year-old just completed his, so I'm thrilled because it has been very isolating, and it's time to get back to a newer normal.
Yes.
So again, thank you so much.
Thank you for having me.
And we'll be right back with our next guest.
Well, we are here. I'm with members of Nashua Public Health and Mike Gabry from Fidelity in order to express our great appreciation to Fidelity for helping us keep our community safe with this wonderful vaccination clinic. Now, we all want to get back to normal, and we also want to keep our communities, our families, our friends safe. The public health experts have been very clear about how to do that. And the way to do it is to get everyone vaccinated. So what Bobby Bagley, a member of Public Health, and Fidelity have done in getting together is they've been able to vaccinate 8,000, provide 8,000 or more doses of vaccination right here at Fidelity. So Fidelity provided the facility, volunteers to help with 6 different clinics, support in terms of food and logistics, everything. So Fidelity has been a great partner to the city, has been an integral part of our effort to eradicate this virus. So we're here to present Mike and Fidelity with a plaque expressing our great appreciation on behalf of the City Public Health Department, and for all that you've done to help keep our community safe. So Mike, thank you very much. Thank you, Fidelity. We could not have done all this without your support and your help.
Thank you very much, Mr. Mayor. I really want to appreciate you for coming out today. If you can see under my mask the smile that I have right now, an appreciation for Nashua Public Health and everything that we've been able to accomplish here together. It was really important for our company that we're able to offer the resources we have available in places where we have sites like this and make use of our beautiful campus to help increase vaccination, especially for healthcare and childcare workers, like was the focus here. The partnership with your team has been incredible. We very much appreciate you, and thank you very, very much for the award. Really appreciate it. Look forward to working together again.
Now, before we finish, I wanted to make sure you met Bobby Bagley, Director of Public Health and Community Services, Patty Crooker, who is also with Public Health, and Nicole Shute, Nicole Shute, who is also with Public Health. Do you want to say anything?
No.
Okay. All right. Well, thank you to our public health employees, to Fidelity, and everyone get vaccinated.
Welcome back to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And now I'm happily joined by our guest, Joe Bernard, college student and COVID survivor, to come talk to us about your experience dealing with the COVID-19 pandemic. So thank you, Joe, for joining us.
Thank you for having me. It's a pleasure.
And full disclosure, Joe comes to us via our chief public health nurse, Kim Bernard, your mom.
Yes.
But, when we were talking about, knowing people that had COVID, she thought your story was one worth telling. So again, thanks for coming. And let's just start. You are a student at, now I'm going to get it wrong, Southern Connecticut State University, 12,000 people in New Haven, Connecticut.
That's right.
And you are a junior this past year, so you're almost ready to be a senior because
right.
you are done for the year.
Yes, I am. I'm home.
And what's interesting, too, about your story, Joe, is that you are a resident advisor, or you were one for the year. Mm-hmm. So I kind of want to start there with the whole move-in and what it was like during the pandemic to be in that position of responsibility on a college campus when
Sure.
kids are moving in.
Of course. So I was in a freshman dorm, so I had a lot of new students coming in from all over the place in Connecticut, New York, New Jersey, Massachusetts, anywhere you can think of. So coming into a new environment is a challenge in general. So coming in with the pandemic that just happened and all the new rules that were enforced coming in when you want a college experience was something tough to enforce with masks, no outside guests. Overnight guests were limited, masks always on, sharing bathrooms was tough, extra cleaning, making sure the space was as clean as possible and as safe as possible for all of us, including myself. It was more of a safety first year at school, and it's a lot of trial and error. Moving in was a difficult process. We all had to get COVID tests negative COVID tests before we moved in. And unfortunately, when I moved in, someone ended up getting COVID in between their negative test and moving in. So what happened was we had dorms set aside across campus where they were the quarantine dorms. And what would happen is if you were contact traced or you tested positive for COVID, you would move across campus and you would have to live there for 2 weeks, alone, isolated, quarantine.
And back then it was 14 days.
And
now it's 10 days,
of
but
course.
back, so it's changed.
Think about August, and it's pretty new, and RAs were the only ones on campus at the time, and there was a lot of trial and error. Dining halls had plexiglass in between the seats, and talking to someone across from you was pretty hard because you couldn't really hear them in between the plexiglass. So there's a lot of adjustments and very different than a normal college experience, especially this year.
Now, were classes in person or were they remote?
So I had a few classes in person, but most classes were online through Zoom and something called WebEx. So it was a challenging way, especially it depends on how you learn. So for me, it was nice to be in class because I like to talk to the teacher and hear them in person, but being online was definitely challenging. Anatomy online is not the most fun in the world, but we did well, which is good. But it was definitely a challenge because a lot of classes were online. Yeah.
So here you are, this newly minted RA. You've already had to quarantine for 2 weeks. You've got a lot of kids in the dorm. Are they all sitting inside their rooms, basically doing their classes? Are they allowed to go to the libraries, or how did that work?
So yeah, most of campus was open, so you could go to the library. You just always had to have your mask on. So whenever you're on campus, have your mask on. Guests were limited, so you couldn't really have a lot of friends over. Overnight guests weren't the same. The town that I was in was pretty much shut down for a semester, so you weren't going out, you weren't having that normal college experience that you would normally have, that your brothers or friends had or sisters had, that you always hear about as a freshman. So things were open on campus, but outside of campus, not necessarily. So students were stuck in the dorm, and we tried to make it as fun as possible for them, but it was still a challenge to get them out and give them that similar to an experience that we tried to do, especially with all the COVID rules and 6 feet apart and everything like that. So,
I think about this. I've spoken to a couple returning freshmen that I know, and a lot of them said, well, it's the only thing we knew. That's the only way we've known college was this way, so it was fine, and I loved it. Were you able to keep those freshmen for the second semester? Or did you have some attrition? Did people drop out?
Yeah, I think we still had the same amount of students come back. I think there were a few that said home is probably better for me right now for safety-wise or whatever they felt, their personal opinion. But we brought more people in second semester, but some people left after first semester. We, as a dorm, as a school, we tried to do a lot of activities and events outside, especially second semester as things started to open up, like in America, I guess, within like Connecticut laws and stuff like that. So we got outside, we started to do events, just little stuff like, hey, we got pizza and ice cream outside, come out and join us, or stuff like that. Little games, we did volleyball, just get everybody outside, meet new people, and we tried to make it as fun as possible. We did a little dance party at night. I can think of it, the school did outside. It was just, we tried to make it as inclusive, and the school did a really good job of trying their best to make it as fun and inclusive as possible.
Yeah, and I bet pizza and ice cream tasted really good that night.
Yes,
It's like being outside.
Of course.
So something that our audience should know about you is that you're also a student athlete.
Yes.
So you were under a lot of restrictions as a student athlete. You play football. Just tell me a little bit about how different that was from your sophomore year to your junior year.
Sure. So to start off, we did not play any games this year. So that was
that's a bummer.
Yes, it was a bummer. We're very optimistic the whole year. We might play in the spring. We might get a few games in here and there, but at the end of the day, we ended up not. But we got to practice a lot, and we got to be together a lot, which was I'm happy about. But very different than a normal year. Masks were always on. Smaller groups of workouts. In the weight room, we had our masks on, and it was smaller groups in there. Early mornings were split up, so it was either 5 a.m. or 6 a.m. we would lift. And
early either way.
Yes, so instead of just one big group, it was split up a bunch of different groups. Practices were a lot different than normal. We had to get tested every week. So yes, so tests were, everyone on campus actually had to get tested every week. Plus student athletes had to get tested on top of that. So even if you didn't live on campus as a student athlete, you had to get tested every week. So that was a big difference. And once one person tested positive, that whole team was pretty much wiped out. So we saw it a lot on our campus with different teams. Like, hey, this team's not playing this week. Did you hear? Because they tested
had a
positive.
case of COVID.
Right.
Yeah.
So sadly, that would end it for them. Our spring sports got to play this spring, which is very exciting for them, but it was different. They had to wear their masks. They were traveling still, but in smaller groups and stuff like that. So it was just a whole different year when it came to football. Football, as you know, is a very contact sport.
Yeah, absolutely. I mean, you're in your lineup. You're right face to face.
Exactly. So we would go through different segments, or different phases, we would call it. So phase 1 was just helmets. Phase 2, you could start going more people and put on some pads. Hitting wasn't until late spring, and we got the hit for about a week, which was nice. But our coaches were very on top of it, of making sure that we were as safe as possible, and our trainers were definitely monitoring us as much as possible.
And kudos to them, because this was new for everybody.
Right.
So they kept your team safe. But you did have COVID.
Yes.
When did you find out, or did you have symptoms first, or was it one of your routine screenings that you found out? Or
So it was about early February, right before the Super Bowl, actually. I started to feel
football's everything.
Right. Yes. For me, that's right. So right before the Super Bowl, I started to feel a little weird, and I just thought maybe I had a cold or something like that. And it was a Saturday. I just hung out inside, and then I woke up the next day, and my taste and smell was kind of gone. And I noticed that, and ended up going to get a test, and I tested positive for COVID-19. Had to move to those COVID.
You had to go back to
to my little
your
quarantine
dorms for real this time.
For real this time. So, but I felt fine. It just I couldn't taste or smell. So at first I was perfectly fine. I just couldn't taste or smell. It was a very weird feeling. Moved across and was just kind of hanging out and getting my schoolwork done and everything like that. And then about a few days passed, and I woke up with a fever, not feeling well, stomach bug, just not feeling the greatest. It beat me up a little bit. That lasted about a week of me being bed sick, sweating, chills.
Wow.
Yeah, so it was not a fun experience in the long run. I started off fine, thought it was a piece of cake.
Yeah, you said, I got this.
Yeah.
It's just my taste. It's just my smell.
Right.
And
This
then
is
a few
weird.
days
Tastes
later.
and smells weird. I'm gonna be fine. Wait it out. Hit me a few more days later, and it hit me like a wall. So
Yeah.
it was a very hard experience for myself. But,
And that's the nature of COVID.
Right.
I mean, it does wax and wane, and so you don't necessarily have all the symptoms at once.
That's right.
You can start off slow, like you said, with the taste and smell, and a few days later, bam, ton of bricks.
Yes. And
So,
yes.
did you, now right after COVID, we talked about this a little bit, that you did have some trouble
Sure. Yeah. So
with exercise and that kind of thing.
So definitely, when I was in quarantine, I tried to work out. I tried in my apartment. I tried to do what I could with just push-ups, sit-ups, stuff like that. And I noticed right away that it was not going to happen at the time. It was challenging. I was feeling a little shortness of breath. I wasn't being able to do what I normally could. So I said, okay, let me wait it out and see what I can do here. Ended up waiting. Then when I got back into my normal routine of working out and things like that, practice-wise, in the beginning I noticed my chest was a little bit off. It was not the same as normal. I thought maybe I was out of shape, but it kept going. So ended up, I had to return to football. I had to go get a few scans. Not sure what they're called. They had to get a few scans of my heart, and pretty much it came back normal, which I was happy about. But I had to get those to be able to return. So a few weeks after that, I started to get back to my normal routine. As of right now, I think I'm pretty 100%. But it took about a month or two for it to finally get back into my normal breathing, normal stamina, fatigue, like what I could do. So
it's definitely not something you want to repeat.
no, it was definitely not a fun experience for myself. No.
And then were your teammates having to quarantine as well, or was there any idea of where where you were exposed to COVID?
So thankfully, football didn't start yet. It was
Okay.
early. It was still winter time when I had it, so I was not around a lot of people. I was working at the time, so within that week I was working a lot, so I wasn't around a lot of people. I was isolated to myself, so not a lot of people had to quarantine because of it, which was good. I didn't infect anybody, which is great. One other thing though that stunk about it was that I lost about like 10 to 15 pounds within those couple of weeks of just not being able to eat, not being able to.
That's not good for a big football player.
No, it was not. So trying to gain that weight back was very challenging, and I'm still trying to get back to where I was, but it's just not a fun experience to begin with. So not recommended is my.
So you kind of take that experience back into your dorm.
There you go.
Where you're an RA. Vaccination. Encouraging people to get vaccinated. It probably wasn't readily available at first in Connecticut. What was the situation there? Did the campus offer it? Or?
Sure. So when I got it, obviously it was February, so people of my age were not able to get it yet. But as the time went on and the year went on, the semester went on, we were able to get it on campus, and it was offered to students, and it was very recommended to get it. I actually got mine about 3 weeks ago down in New Haven, Connecticut, and I get my new one coming up in the next couple of weeks. So my second shot next couple of weeks. So it's at my school is very recommended, and I definitely pushed it towards students to get it, and a lot of them did, which is great. And I know a lot of my teammates, a lot of my friends have gotten it as well. So
Yeah. I mean, it just gives you one more step to get back to like your new normal.
right, and that's what we really want to do at school. So we want to be as safe as possible, but we want to get back to whatever we can, get back to similar to what we were.
Right.
before.
And so you'll return in the fall. It'll be your senior year, not as an RA.
No.
That was enough for a year.
Yes, that was a good experience for a year. But
Yeah.
time to move on. I have an apartment next year with a few of my buddies, so
Okay.
it'll be good. Yeah.
And they're vaccinated.
And they will be vaccinated. We all will be vaccinated by the time
Make
we're
them
there
show
in
an
the
ID
fall.
when they come in.
Yes, exactly.
So, well, I'm really glad that you came to share your story. It's very important. People, we talked in the prior segment about pediatrics and young people, and you still, even though you're not a pediatric patient anymore. You're still young. And we are seeing more cases in the younger population as things loosen up a little bit and things become more open. So taking those precautions, keeping your mask on, I'm sure your mom's going to make you do that.
That's right.
You know, keep that mask on and get that second dose. I know you won't forget that either.
Nope.
And, you know, thank you for sharing your story, because I think people need to realize that this affects all ages in the population. And, you know, a month to a month and a half is a long time to recover from something,
Yes.
especially when you're young.
Exactly.
You know, you probably couldn't go to work. You lose out on things. Socializing and all of those things as well.
Yes, big part of it is socializing, was getting people to socialize without endangering each other, which was hard. But we made do with what we could.
Good.
Yes.
Well, I'm very happy for you, and I really hope that you'll be able to go back to somewhat more normal in the fall for your senior year. That's very exciting. Congratulations.
Thank you.
That's awesome. And, you know, treasure and cherish those memories, because they go fast, spoken from an old person. And I just want to remind our audience that we do have free COVID testing every Tuesday from 3 to 4:30 at the Elm Street parking garage. That's right behind City Hall. You can make an appointment online, or you can call our hotline, 603-589-3456. And I also want to remind everyone that vaccine is readily available right now for those age 12 and up. The fixed sites are still operating at Sears in Nashua. They take it walk-ins after 3 p.m. So please don't hesitate to get that vaccine, anyone 12 and up. Or you can look online, vaccines.nh.gov, and make an appointment. Thanks everyone. Have a great weekend.